Coming to the extrapyramidal tracts, the part of descending brainstem and spinal pathways which do not pass through the pyramids and are concerned with postural control are referred to as extrapyramidal system. There are various extrapyramidal tracts. They include medial longitudinal fasciculus, lateral vestibulospinal tract, medial vestibulospinal tract, reticulospinal tract, rubrospinal tract, tectospinal tract, and olivospinal tract. Medial longitudinal fasciculus. It arises from the medial vestibular nucleus, reticular formation, superior colliculus, and interstitial nucleus of Kajal. The tract descends down uncrossed up to upper cervical region. Their important functions are coordination of reflex ocular movements and integration of movements of eye and neck. Lateral vestibulospinal tract. It arises from the lateral vestibular nucleus of the same side, run uncrossed, and it ends at various levels of spinal cord. The important function of lateral vestibulospinal tract is to maintain muscle tone and posture and maintenance of position of head and body during acceleration. Whereas medial vestibulospinal tract, it arises from medial and inferior vestibular nuclei on both the sides, descends uncrossed, and ends at various levels of spinal cord. Their important function is maintenance of equilibrium and muscle tone. Reticulospinal tract. It arises from the reticular formation of pons and medulla, descends mostly uncrossed, and extends up to the thoracic segments. Their important function is to coordinate voluntary and reflex movements and control the muscle tone. Rubrospinal tract arises from the red nucleus, crosses to opposite side, and extends up to the thoracic segments. Their important function is their facilitatory influence on the flexor muscle tone. Tectospinal tract. Fibers arise from the superior colliculus in the midbrain, cross to the opposite side in the tegmentum, and descends up to the lower cervical region. And their important functions, they indirectly connect the retina with the spinal motor neuron and coordinates the retinal impulses with body movements. Olivospinal tract fibers, they arise from the inferior olivary nucleus of the medulla and crosses to the opposite side and descends up to the cervical region. It is less developed and less important in mammals. Their important function, they control the movements due to proprioception. Disease or lesion of the extrapyramidal tract causes difficulty in initiating voluntary movements. So these are some of the difference between pyramidal tracts and extrapyramidal tracts. Pyramidal tracts, phylogenetically a newer motor system developed recently, and extrapyramidal is an older system. The pyramidal tracts axons pass without relay to the spinal segments where they form synapses with either interneurons or dorsal horn directly with the motor neuron themselves, whereas extrapyramidal tract, the discharge occurs through the several tracts. They are polysynaptic and multi-channel pathway. Pyramidal tracts, they have a greater influence over the motor neurons that controls muscles involved fine movements, particularly those of fingers and hands. Whereas extrapyramidal tract, they involve in the coordination of the large group of muscles used in the maintenance of upright posture, locomotion, and head and body movements, and when turning towards specific stimulus. The pyramidal tract's lesions produces spasticity, whereas the rigidity produced in case of extrapyramidal tract. The pyramidal tracts starts functioning after the completion of myelination at the second year after birth, whereas extrapyramidal tract starts functioning from before the birth. The pyramidal tracts, the rate of conduction of impulse is slower and it is faster in extrapyramidal tract. Pyramidal tracts, only facilitatory fibers are present, wherein extrapyramidal both facilitatory and inhibitory fibers